Welcome back. Meet the president tonight with independent presidential candidate Dr. Japheth, if you like, Dr. Jeff Kaluyu. But the name that will appear on the ballot is Dr. Japheth Kaluyu.
Kavinga Kaluyu.
Kavinga Kaluyu.
Yes.
Okay,
yes.
Just so that everybody's clear when they go to the ballot on the 8th of August, yes? Yeah. Okay, so we'll get to the issue of health like I promised, but I'd like to take a look at some feedback that's coming in on social media. At Kenyan Story says, cutting taxes is just a lie. Wait, tax incentives again? Good stuff, but how is it applicable in Kenya? Joanna Kimwele says, this guy is too genuine. Is Kenya ready for a clean sheriff in town? Collins Munyendo says, there's a new sheriff in town. I like Dr. Kaluyu's fresh ideas. Top bloke. You say your username is Mungai for MP Kiambu 2017. You say, huyu hawezi pata hata kura kumi, atakuwa president operating from diaspora. Nduva Peter says, the guy is dreaming, but ni sawa because it's acceptable to dream. So I'm pretty sure you see quite a bit of this feedback. Keep them coming in. And any questions you would like to ask him as well, we will pose those to you. Okay, so let's talk about the issue of health in the country. Yes. You know, we're currently in the midst of a strike by the nurses. We had one with the doctors for 100 days. This is really your expertise. What do you think is ailing the health sector in the country, and how would you fix it?
One of my areas of strength is labor negotiations, and 3 times at least I have trained consultant with folks from specific labor unions in Nigeria, and I've taught that subjects how to do it, starting with the agreeable issues and all that. What we lack specifically is good standards of salaries. And those standards needs to be the first thing they will be reviewed. Because some of the labor union complaints are genuine. If you are a nurse working 24/7 and your salary is pretty low, given the work you work every day, you're going to ask for it. And there is also another trigger effect where you see the doctors are striking, tomorrow it's us police officers, tomorrow it's going to be different groups. So standardization of salaries so that people can get living wage. Either we standardize it at a higher level to have living wage, because sometimes if you standardize at lower level, people still earn, but they can't afford, because we have almost close to 50% that still stick with over 40% unemployment rate. So close to 50% of Kenyan population are working, but they cannot afford what they're supposed to afford. We call them the working poor. So when people see that and their salaries are not standardized, they are struggling. So I will use my expertise in labor negotiations to be able to first to standardize the salaries, and also in labor negotiations.
So what do you think has been the challenge with labor negotiations, particularly in the health sector?
Because labor negotiations is just labor negotiations. There's nobody with the upper hand and nobody with a lower hand. It is just that, negotiations. Everybody should be permeable, should be able to be willing to come to a solution. We start with things we agree with. You'll be surprised. Okay. Most of the labor issues, the differences that cause people splitting in different directions, they are this much. 90% they agree.
You're speaking in a bit of a generality.
Okay.
So I would like you to speak specifically about the issue in Kenya when the doctors are on strike for 100 days, with the nurses being on strike now.
Yes.
What do you think are the sticking points in your assessment?
Because of
very specifically to this issue, you know, and how you would propose to solve it.
Broken promises.
Such as?
If you are promised to be added salaries a particular time, or you are told you will be given like salary increase by doctors in July, the doctors expect that. And therefore, if you promise, you do not politically promise, and then July comes in, and therefore you do not satisfy your end of the stick, because those were the agreements. Because there are promises. If you talk of teachers, there were promises salaries from maybe 90s.
Yeah. The teachers are sorted now.
Yeah, the teachers are sorted, but that is a good example of what happened, and they had to stay away, kids had to go home. Okay. The same thing as doctors, there's no difference, because majority, the common thread is broken promises. And we want, as government, we will keep our promises to the workers. We will be able to tell them, this is the rate we can afford. And sometimes it's not about taking a hard line. It's about explaining to people, Kenyan literacy rate is very high. If we increase salaries for you, we have to take it from somewhere else, or we need to finance it. If there is genuine talk and understanding of economic dynamics of labor relations, people can understand. I don't see that is being put together. Why they are not being increased? Why not this time? Because you can still promise, in July you tell things come up.
So you say it's broken promises when it comes to salaries.
Broken promise is the big problem. Yeah.
So what else do you think is the problem?
The problem
in the healthcare system in the country?
On the healthcare system in the country, it's too expensive. The healthcare system, and I know if you have an NHIF card, you can pay 6,000. It sounds 6,000 a year. A lot of majority of families in this country cannot afford 6,000 Kenya shillings a year. That's a lot of money. Number two, what does it cover? If you're a lady, you are hit with cervical cancer, Kijabe will not be willing to give you just treatment for...
NHIF has expanded its cover this year quite extensively.
Yeah, so it has...
What is your perspective on the cover that is now being done by NHIF? Are you familiar with exactly what it covers?
No, not the exact numbers, but I have this year alone, I had a family member who was hit by cervical cancer. I'm not just throwing numbers there or talking about it. She had to go to Kijabe. Despite the fact there is some sort of coverage, she couldn't afford it, despite all those expansions. As an end user, I'm not interested on what is covered. I'm interested, can I be covered?
Was that a problem with the hospital or the cover itself?
The coverage wasn't enough.
So at Kijabe, she would have gotten the help she would have required? It was the amount of money from NHIF?
The amount was astronomical in the hundreds of thousands, but if it was enough, she could have used that enough and she would have been treated. So when you tell me whether there is, whether there's the numbers or the list, the end of the day, what a Kenyan person, average Kenyan person wants to know is that if I'm hit by a disease, that it will be covered. And if it is a no, I don't care about the list. So the healthcare, what I would like to provide is universal healthcare so that every Kenyan can be covered. Or there is a formula of how to cover the Kenya, depending on the categories that you create, depending on the quality of care you want, and the kind of hospitals you want to be able to visit. So we need to be able to have segmented coverage of how you can afford, but the lowest of the lowest should be as a right to be able to get coverage of healthcare.
Devolution of health? What are your thoughts on that?
Devolution of health. I think the devolution of health can be done if it is funded by the government, federal government. There is nothing wrong with that. It should be, it can be...
It is funded because the money comes from the national government and it is then disbursed to...
Yes. So this is the thing is, healthcare is very expensive. And some of the things that were not necessarily factored in, let's say there is level 1 to level 5 hospital. Let's say an example in Kitui. Anybody who gets sick, because level 5 hospital in Kitui is just near across the road, they come with a wound on level 5 hospital. It jams the hospital. So some of those small things were not taken into consideration. So it increases the healthcare cost for doctors attending things that are not level 5. And if you send someone to level 4 or level 3, the ambulance needs to be available. Maybe it doesn't have gas, it doesn't have this. So the healthcare, when it is devolved, it becomes very expensive. There needs to be a new look.
How does it become expensive when it's
Because if you're attending a wound at a level 5 hospital, you require more doctors. Because so many people are having unnecessary level 5 hospitals. So that increases the healthcare cost. Number two, we need to have integrated services. For example, let's say Kitui Hospital has a clinic that is HIV, and there is a nurse, there's a lab technician, and maybe a doctor coming to visit. And then that is a separate small item, and only maybe 3-4 people a week comes to visit it. So some of the healthcare costs can be integrated to see the doctor at the same time and get your HIV kind of tested, lab done, and all this does not have to be a separate item, which carries a lot of salary. So when it comes to Western healthcare...
But doctors don't do tests for HIV and such like
Lab assistant, they order. What do you mean? They can order.
But they're not the ones that conduct the tests.
Of course. It's lab assistants.
Yeah.
Oh, well, that's not an issue. So they will send it to the necessary people to conduct the test, and then they come and read the test, and then they will do the prescription or send the person for counseling where they need to be able to be counseled. So the cost of healthcare, this is a serious topic. It is very high. And when the health goes up, a lot of people cannot afford to go to hospital. You know what they do? They don't go to hospital. When you don't go to hospital, what happens? It means that you affect your work, you don't go to work, or you work under capacity. So
how would you make then healthcare under devolution cheaper? And what are your thoughts about how the devolution of healthcare specifically was done?
Yeah, so the devolution, it is necessary, it can be done, but we need to increase the funding and specifically put the fund separately as a category in budget category. Now, in devolution, they have a right to do budgets, but the line items, they decide. They have freedom to decide how they do the budget. That's one thing counties have. So I would like to see
So are they, putting the right priorities? Are they allocating enough money in your assessment? You come from Kitu, you talk about that a lot.
Great question. I think it's not enough.
Yeah.
I don't think it's enough.
How much would be enough?
I would like to, as a scientist, I can't answer that just directly. I would like each county has its specific needs. It has its terrain. It has its rich kind of population, beliefs, culture, attitudes, and religions. So you cannot just say the kind of money that's going to be done in Kisii will be the kind of money that will be required in Kitui, because these are two different populations. So we would like to have specific county assessment, and we allocate as a priority health. A sick society is a productive society, and I would like to see that be put as a priority. I don't think in Kenya, across Kenya, health is put as a big deal. You just get sick, just sleep it over. But when you get sick, you can affect other people.
Okay, so you're saying then that the allocation should be county-specific, perhaps as it should be. How about the amount of money that goes from the national to the counties? How much would you propose?
I would propose close to 50%. Maybe, I know...
50% of national revenue?
No, minimum 50. No, it's almost close to 50%. Between 45 and 50% allocation. You're
to health alone?
No, not to health, to the counties. I would like the counties to increase.
I'm speaking about health.
Oh, I would
We're still on health.
Oh, yeah, if you're talking of health, depending, and again, I'm a scientist, I will not, and I know the population of different counties is totally different for each county.
No, we're talking about from the national government to the county government.
Yes.
How much do you think should be going to the counties with respect to health?
I would think between 15 and 20%.
Okay.
Yeah.
So let's talk about what else ails the health sector. I mean, in your view, what is that one thing that you would do if you became president that would say specifically that will be your legacy? Maybe 10, but let's look for one.
No, that's fine.
Yeah.
It is training a front-end group or healthcare workers that attend healthcare or health issues, small issues, like first aid in the front end before even they get to the level 5 or level 3 hospital. So that some of the things, headaches or lifestyle in terms of prevention will be my big thing. Prevention is a huge thing, but we also trained certified front end first aid, basic healthcare workers who teach local people. And
but
on top of that,
there's also, a shortage of doctors. What's your assessment of that? The number of oncologists we have in the country, the number of specialists, because prevention is great, and it's huge.
Yes.
But what's your assessment of the shortage in the country? How many more do we need to employ? Yeah. How will we employ them? How does that work?
So it is more of, because my plan, I talked about 6-point plan. And I said it is more of a concept than the plans. Because what we see in manifestos is like people are looking for what is popular. Then they say it in a 12-line item, which I think that it has been done 20, 30 years. Because the issue now is why should we believe you now? Because we have been doing it for 20, 30 years. Now, what I say is that there is a holistic view to lack of doctors. We are losing a lot of nurses and doctors abroad. There is brain drain, and that is real. I have been part of it.
So what are those
I have
numbers?
Seen it. So it is increasing the salaries. They are running away because the salaries are low. Talk about these nurses. They are being taken away by first world country in left, right, and center.
Dr. So, I'm looking for some specifics from you.
Yeah.
And I think that might give Kenyans some hope that you understand the issues, you understand the shortage, and understand how to solve that issue of the shortage of doctors. Brain drain is no doubt, not just in the health sector, but in others. But how many doctors do we need in the country? How would you seek to employ more? Is it just about salaries that's causing the brain drain of doctors leaving the country?
So the brain drain, that's one of the solutions. I'm glad you accept that I gave you one of the solutions, that is to prevent brain drain, which is a real solution.
Yeah, but how is the question?
So, exactly. Yeah. So we will increase their salaries. We have to look at reason why do they just walk away. They don't just walk. Because they are not being paid a lot. Every other country, they take the health or human health as very sacred and important. So you'll
increase it by how much? And where will that money come from? Because right now, the government is saying, they don't have that money, and it is up to the Salaries and Remunerations Commission, which I will remind you, Dr. is an independent constitutional commission that you would not be able to walk into SRC and say, give the doctors more money, give the nurses more money.
Yes. So most of these programs I'm talking about, they can be funded. You're saying there is no money. If things stay as they are. But things under my administration, if Kenyan people give me the opportunity to
funded how?
That's what I'm going to explain. So they're going to be funded. There's a lot of waste. There's a lot of, we lose billions of money, almost 300 billion in terms of corruption from the government waste. So if we recoup that corruption, I said I will be the end of corruption. So there is money ready for that. There is a lot of government waste and duplication of services. There's a lot of duplication of services because most of the people, when the funding comes from outside, they are, instead of funding the existing programs, they set up a different program which is similar, so there's duplication. So there is a lot of money, and also just using Six Sigma, lean mean system where we identify who is working where things are placed, we can actually recoup so much money from the government, and therefore we can use this money to fund even some of the salaries without having to increase a penny on taxes.
Okay.
So we can do that.
All right. So we've come to the close of 1 hour. How time flies.
I know.
This final question I have for you. What happens if you don't win? Will you go back to the United States?
So here's the thing. Kenya is bigger than any presidential candidate. And if I do not win, and there are two sides of it, winning and not winning. If I don't win, I would like to solicit other candidates to take my plan, 6-point plan, which I believe is very strong, because I'm not the Kenya. I'm not the person to walk away. I would like them to consider my plan so that my plan, it wasn't just a waste. It can be implemented, and we can work together for the benefit of the bigger Kenya. But should the Kenyan people give me the opportunity to be their commander-in-chief, I will not only not wait, I will solicit from every single candidate, from President Uhuru, from Raila to Ndinda and everyone else. I will solicit their plans so that I can consider it, we work integratively, and we be able to move this Kenya forward.
Would you be looking towards working with them in some form of coalition?
Every candidate should be able to work even beyond the election. This is not about election. If you came
so you will stay in the country?
I will stay the way I've always worked for this country. I did not start working for this country for the election. Every single candidate in this election, I challenge them. They should be willing, and they give a promise. They continue to work beyond elections. Because if this was about election, then it is useless to run for election. So you will be
stationed here in the country and not go and
I've always been stationed.
Parachuting in and out on long-hour flights?
I have always been stationed in this country. I have interest in this country. I have property in this country. And these days, you are an international citizen, and you can be able to do what you need to do, and I help my Kenyan people. So I'm ready for duty, but I believe I will be the one to win because of the right plan for the country.
Okay. Someone's asking about your family life.
Yes, I have family, that's it, in the US, in the United States.
Okay. Kenyans worry about politicians, now that you're one, who have family outside the country.
Esa diaspora.
Does that bode anything? Because many would say, if anything happens, your family is safe and secure in the United States. We're the ones feeling the crunch and the unemployment rates you're speaking of.
Here's the thing. I'm diaspora. I am a very unique candidate. And that's why I would like to be unique and win this election. Because even in terms of expense, by the time I land here, I'm already under 100,000 Kenya shillings under everybody else before I spend because of the air ticket alone. You got to have passion to be here. So
will your family come back?
Of course. So when
are they here with you?
No,
Kenyans would like to know.
I am a diaspora.
You're a diasporan?
Yeah. So
not Kenyan?
Are there Kenyan diaspora, Miss Yvonne?
I'm asking. I'm asking you.
Kenya, the diaspora, we have.
Because you identify very strongly as diasporan.
No, that's when not identify strongly. I'm stating the facts. This is not identification.
So it's a fact that you are diasporan.
I am a diaspora. President Kenyatta was a diaspora. Raila was diaspora. Kalonzo, I don't know whether he was a diaspora, but majority of maybe 8 out of 10, maybe 7 out of 10 of 4 presidents of Kenya were diaspora at one point, and they came to be president. So diaspora is not something bad. We learn a lot of things out there. We know Kenya just the way you know Kenya, but we have gone beyond Kenya and learn other things. We would like to bring that expertise back to the country, just like any other president. President Kenyatta was in the US with us. Honorable Raila was in different area, and so many other presidents who have been there. Kibaki was in different parts of the country. So diaspora is not a big deal thing. It's just us.
Okay.
And the other people, we are diaspora in Tanzania, just don't think diaspora is the United States alone, Tanzania and other surrounding countries.
Fair enough. Dr. Jeff Kaluyu Kavinga? Kavinga Kaluyu. Dr. Japheth.
You got it right this time.
Dr. Japheth Kavinga Kaluyu.
Yeah.
He's an independent presidential candidate. He is seeking your vote. Are you convinced? Please continue to have the conversation. We hope you know him a little bit better now and are informed about those who are seeking the office, the highest office in the land, and seeking your mandate. Will you vote for him? The hashtag is Meet the President. Please continue to have this conversation and continue to engage Dr. Japheth wherever you meet him across this country. Thank you very much for making the time to be with us on the show. Has been Meet the President. Thanks for watching. I'm Yvonne Okwara Matole. Till next time. Bye-bye.
Thank you.
Thank you.
Thank you for having me.